Why are there such drastic differences in incidence rates for the same health issue between certain populations? This is the beginning question when examining health disparities. My name is Martia Mathis, and in this presentation we'll be discussing health disparities in infant mortality amongst African Americans. About infant mortality. In the textbook Race, Ethnicity, and Health, Leviest and Isaac define infant mortality as the death of children under 1 year old. The United States has one of the highest infant mortality rates among other developed countries, according to researcher He in the 2015 article Trends in Infant Mortality in the United States. Furthermore, in the article Perspectives of Women on Infant Mortality, G. Barnes writes, infant mortality is more than a dead baby. It is the most sensitive measure of the well-being of a population group and reflects the effects of negative social and medical experiences of the mother. This is the perfect quote to explain why infant mortality is such an important matter in the United States, and specifically in this presentation why it is so important among African Americans. So, how does infant mortality relate to African Americans? African American infants are 2.3 times more likely to die within the first year of birth than white infants, according to the 2015 Kelly report. This is primarily due to complications such as birth defects, preterm birth, maternal complications, SIDS or sudden infant death syndrome, and injuries. These are actually the top 5 causes of infant mortality according to the Center of Disease Control. These causes actually account for over half of the cases of infant mortality in the United States. It should also be noted that according to A. Bryant in the article Racial Ethnic Disparities in Obstetric Outcomes and Care, that African Americans have the highest rate of preterm birth. So how can we explain the pressing issue of infant mortality among African Americans? It is well documented that there are deficits in the quality of health care received by African Americans. According to the 2015 Kelly report, African Americans have higher rates of people who are uninsured as well as higher incidence and overall mortality for a variety of diseases. Furthermore, in the 2007 article, The Growing Color Divide in U.S. Infant Mortality, R. Sines writes, recent increases in black infant mortality also coincide with significant cuts in programs designed to assist the poor and erosion in jobs held by many poverty-level workers. In the article Trends in Infant Mortality in the United States by researcher X. He, it is mentioned that infant mortality is associated with a variety of factors that includes maternal health, socioeconomic conditions, and public health practices. With that being said, we should note that African Americans are known to have lower socioeconomic status, in turn receiving poorer quality of care, therefore affecting their maternal health. In conclusion, infant mortality is a greater issue among African American women and infants than it is for women and infants of other racial or ethnic groups. These differences can be attributed to lack of education, lack of quality health care, and lack of other resources to promote healthy pregnancy. According to M. Bartell in the report of the Secretary's Advisory Committee on Infant Mortality, strategies for reducing infant mortality rates in African Americans include improving preconception health of women and ensuring access to health care. It is important that we are working towards having the healthiest population possible, and that includes African Americans and infants. This concludes my presentation. Thank you for listening.